Welcome to the Explainer. Today, we're going to crack the code on one of the most common areas you'll see as a medical coding student, individual psychotherapy. I know, when you first look at that list of codes, it can seem pretty confusing. But our goal here is to build a super simple mental framework, turning what looks complex into a clear, step-by-step process you can use every single time.
Okay, so let's dive in. We're going to follow this clear 5-step path. I want you to think of it like a decision tree that every coder walks through to land on exactly the right code. First, we'll nail down what the service actually is, then we'll look at time, then other services, handle some of those tricky exceptions, and finally, we'll wrap it all up. So, first things first. Before we even think about picking a code from a list, your absolute first step is always to confirm what you're looking at. What does the provider's documentation actually say was done?
What the CPT guidelines are telling us here is that psychotherapy isn't just a casual chat. It's the active treatment of a mental illness. It's a targeted service done by a qualified professional with the real goal of helping someone, easing their emotional distress, changing behaviors that aren't working, and helping them grow. That difference between just evaluating someone and actively treating them, that's everything.
All right, so we've confirmed we're dealing with a real psychotherapy service. Now we get to the single most important factor for choosing the right code. And that factor is time.
Literally everything in this set of codes hinges on the answer to this one question. This is exactly why clear, precise documentation of the time spent face-to-face with the patient is absolutely 100% non-negotiable for coding this correctly.
Now, what's really cool about this is how it simplifies things, right? Instead of trying to memorize 6 random codes, you can see they're just 3 pairs. Each pair is tied to a specific time range. So your job is to just find the time in the patient's record and see which of these 3 buckets it falls into. Simple as that.
So, that brings up a pretty obvious question, doesn't it? You see that first-time bucket starts at 16 minutes? Well, what happens if the note says the session was, 15 minutes long?
And here's the deal. This is a hard and fast rule. There are no exceptions. If the service doesn't hit that minimum 16-minute mark, you cannot report it with one of these psychotherapy codes. It's a totally binary choice. 16 minutes or more, you keep going. Less than 16 minutes, you stop. Period.
Okay, let's build on that. We've used time to figure out the right row in our table. But now we have to choose between the 2 codes sitting in that row. And that brings us to our second big question. You were probably wondering that, right? The reason for these pairs is to handle situations where the therapist does another really important service on the same day. And we're talking specifically about an evaluation and management service. You'll hear it called EM for short. This is when the provider is also, say, assessing the patient's condition and managing their overall care, which goes beyond just the therapy itself.
And this chart lays it all out perfectly. See the codes on the left? The ones ending in 2, 4, and 7, you use those when only psychotherapy happened. But the codes on the right, ending in 3, 6, and 8, those are special add-on codes. You use them in addition to an E&M code when the provider did both services in the same visit.
Now, listen up, because there are some really important rules here. When you use one of those add-on codes, the time you count for psychotherapy has to be completely separate from any time spent on the EM part. You cannot double-dip the time. The EM code gets chosen based on its own rules, usually the complexity of the medical decision-making, not by how long it took.
Okay, so we've covered the main path. Now let's look at a few common scenarios that can really trip up new coders. This is all about knowing what these codes are not for and when you need to start looking somewhere else in your codebook.
So while family members might be in the room during an individual session, if the whole focus of the therapy really shifts to the family dynamics, how the family unit is working together, well, you're in a different territory now. That needs its own specific set of codes, and you would not use the ones we've been talking about.
This is another super critical distinction. If a patient is in a crisis and the provider is doing an urgent assessment and providing therapy right then and there, that's reported with crisis psychotherapy codes. The guidelines are crystal clear on this. You cannot report the standard psychotherapy codes on the same day as crisis codes. It's one or the other.
Now, this one isn't a different path. It's something you might be able to add on. If the session gets extra complicated because of specific communication issues, like you need an interpreter or the patient is nonverbal, or maybe a caregiver is making things really difficult, you can report this separate add-on code plus 90785 to show that extra work went into the session.
So, let's recap. We've walked through our whole decision tree. Is it psychotherapy? Yeah. How long did it last? Got it. Was there an E&M service too? Okay. Any special circumstances? Nope. Let's boil all of this down to the single most important principle you need to lock into your brain.
This right here is the key takeaway. If you remember nothing else, remember this. These codes are for treatment, not just evaluation. Their selection is driven by documented, face-to-face time, and the patient has to be there for all or most of it. That's the heart of everything we've talked about.
And that's the question I want to leave you with, because answering it is what takes you from being a student who knows the rules to a professional who can apply them. What specific words, phrases, and most importantly, data points like start and end times would give you the rock-solid confidence to assign one code over another? Mastering that? That's your next step. Thanks for joining us for this explainer.